Okay, good morning, good afternoon, good evening. Welcome to the data collection webinar series, and we're very happy. Oh, something went wrong on my end. Can people hear me? Hello? Can somebody say something?
Yes, I can hear you.
Yes, you can. Okay,
Yes,
thank you.
please, yes.
Thank you so much. Okay, so again, I'd like to welcome you to the data collection webinar series. And today's session is on mobility data from digital traces. And we're very happy to have Frank here with us. So we'll just get started. And I was hoping Attila would be on. I'm just trying to figure out what happened, but hopefully he'll show up as well. So my name is Archana Dwavetti, and I work with the data collection unit in the data and analytics section. This is the 6th webinar after we resumed the webinar series in April. As I mentioned before, today's webinar is entitled Mobility Data from Digital Traces. The use of mobility data has seen a meteoric rise in the past years. Novel data sources enable us to see how humans move through the digital traces they leave in ways that were not possible before, opening up a myriad of applications, from tracking migration behavior to fighting the COVID-19 pandemic. Today's webinar will demonstrate what mobility data is, what it is used for, and how we can use it in Unicef. As I said before, we're very lucky to have Frank Schlosser here with us today. He is a researcher at the German Ministry of Health and the Humboldt University of Berlin. Currently, he is heading the COVID-19 Mobility Project, which uses mobile phone data to track the behavior of Germans during the COVID-19 pandemic, offering key insights to policymakers and public health officials. Frank has a background in physics and uses math and programming to study human mobility and epidemic spreading. So before we begin, some housekeeping points. We have scheduled for about an hour and a half today, starting with the presentation followed by a Q&A. As always, throughout the webinar, kindly remain muted and kindly write your questions in the chat box. We will try and group your questions and direct them to Frank during the Q&A. This webinar is being recorded and will be available on our SharePoint site for those of us within Unicef, and it's also there with all the other past webinars. You can find the link in the email that you had received earlier. We do plan to put these out on an external or public site to colleagues who are not Unicef staff, and we hope to have them access it in the near future. So Frank, over to you. The floor is all yours.
Yeah, thank you so much. And hi, everybody. And thanks for having me. I'm very happy to talk today about mobility data from digital traces. So it's a very general title, and I'm going to talk about it in a very high level sense, but also go into some technical details. So I hope there's something for everybody, whatever your background is, whether you're more business minded or more technically interested in the topic. So just to briefly outline what I'm going to talk about today, so I want to answer what is mobility data? So what are the common sources of mobility data that we can use nowadays, and focus specifically on some types of data that are actively used, most commonly used by researchers in different contexts. I want to highlight some of these contexts and show typical use cases for mobility data, and especially talk about the work of my team, where we studied mobility during the COVID-19 pandemic in Germany. Then I also want to give some practical tips on how you can work with mobility data, where you can get it from, and some caveats. And finally, I also want to highlight the topic of biases in mobility data sets, which often is not much attention paid to it. And I want to show a case study that I've been working on with people from the Office of Innovation, where we looked at these representation biases in mobile phone data sets. So just briefly, my background. So I have a quantitative background in physics. I'm currently working as a data scientist and researcher at the Robert Koch Institute in Germany, in Berlin, which is part of the German Ministry of Health. So the Robert Koch Institute is sort of the German Center for Disease Control. So we're studying infectious diseases in humans. And I'm also a PhD student at the Humboldt University, and my group, Research on Complex Systems, is partly situated at the Humboldt University and at the Institute. And we study all kind of complex phenomena in humans, in societal systems, epidemic spreading among them. So my specific focus is on human mobility and epidemic spreading, which is a topic that has gained in attention a lot, for better or for worse, in the past year. And so in my projects, I'm looking at mobility during the COVID-19 pandemic, how we can detect outbreak origins from mobile phone data, and also the issue of representation bias in mobility data. I want to briefly highlight my connection to Unicef because I think it's very interesting. So I was a visiting researcher at the Unicef Office of Innovation in 2019. I stayed there for 3 months. And there I worked with the Magic Box team on different projects. Among them, we made epidemic models for the spread of Ebola in the Democratic Republic of Congo. And we also investigated biases in mobility data. And this connection, this academic connection that we have established has been ongoing since then and very fruitful. And so if you want to stop listening now, I just want to have you take away one thing, that is seek these partnerships with academia and invite external researchers, because I was only there for a brief period of time, but this has led to a very fruitful collaboration for all involved, and was a great experience. All right, so first of all, I want to talk about what is mobility data. So there has been a big change in the field basically before and during the 21st century. So in the 20th century, before the 21st century, there were only very limited capabilities to know about how humans move. Basically, the only way to get this information was through surveys. For example, a census survey, where people might be asked where they live and where they work, or more specific questions like what is the length of the daily commute. And from this, you can kind of extract mobility patterns. And there are also different other types of surveys that might be more regional and more specific in certain aspects. But in general, these types of surveys, they give you a very averaged, broad picture of mobility on a large spatial scale, so more on a regional, national scale. And they're often monthly snapshots of mobility, for example, commuter mobility. But then, yeah, in the early 2000s, something changed and something miraculous happened, namely that all the people started running around with little sensors in their pockets that measure a lot of their data. So these are two pictures from the inaugurations of two popes, Pope Benedict in 2005 and Pope Francis in 2013. And yeah, what you can notice is that everybody is having these computers that they carry around that generate a lot of data, which can help us, well, actively measure a lot about individuals in a way that was just not possible before. Even if you did an experiment or something, you would get a limited sample of individuals. And now, well, almost everybody has these supercomputers in their pockets that generate a ton of data. And so this has opened up a great new way of getting knowledge about human mobility through these devices, ranging from mobile phones, which started out as dumb phones, then to smartphones, which generate even exponentially more data, especially if you use it, for example, in applications like for navigation. And accompanying to that, we also have this whole ecosystem of apps that are services that you interact with and that you exchange data with, and that also store this data in some form or make it accessible. And so this has basically completely changed the picture that we have, and we now are able to go into much more detail and picture mobility with a much higher resolution than was possible before. And so here I've highlighted 3 types of data sets that I'm going to talk about today, which is call detail records, social media data sets, and smartphone GPS data, which are all tied to mobile phone usage and which can give you a very detailed picture of mobility, with smartphone GPS even going into trajectories on a minute or second resolution, where you can distinguish individual locations of individuals. So to reiterate, what I want to talk about here are big data digital traces, so big data sources of mobility. These are in contrast to traditional surveys and experiments, which are also used today and which also have their usage, but which are a bit different in focus. So, for example, you can also use surveys and questionnaires, but you can also use these GPS trackers, for example. Last week we had a great talk by Trevor Croft, and his colleagues, if you attended the webinar, where they talked about how such GPS trackers are used by the DHS in the UK to measure mobility of people. But the difference is here that in these cases, you have an active measurement of a more small sample of individuals, which has its advantages. For example, that you get generally higher quality data because you can design which data you want. And it is also mostly more representative because you can select your sample population and you know more about their metadata, so their age and gender and so on. And so you can make sure that what you're measuring is representative of the general population. But this type of measuring is generally more expensive. If you, for example, use GPS trackers, you'll get a smaller sample and you often only get a limited data set because you only measure in one specific region. And the big advantage of these big data sources is that you can passively capture the mobility of many, many users. So if you have a big, depending on which technology you use, if it is widespread, you have a very large sample size, which you can measure with a low cost. But also often this type of data has a lower quality because you often also cannot directly control what exactly you measure. And there can be biases and representation issues, which I will also go into detail later on. So I want to briefly go through some types of mobility data sets, which account for almost 99% of all data that is used in practice. So this is a bit more technical, but I think it's good to kind of know how exactly is mobility measured? How does it work in reality? Because that helps you to understand the limitations also of this data, but also the possibilities. So one of the most common types of data are call detail record data sets. So these work like this. This is data that is collected from mobile phone users by mobile network operators or MNOs. So this is data that is captured just in their daily operation, which is really amazing because it's sort of a byproduct of their day-to-day operations and thus often very available in a large-scale fashion. So because these MNOs often have a very good coverage of of the population in a country, for example, that makes it easy to capture a large-scale picture of the whole population in a country. And a big advantage is also that you have a global availability of this data because mobile phones have, there's a high proliferation of mobile phones globally now, and especially in low or middle income countries where other data sources might not be as prevalent. So this is basically the biggest advantage that call detail record datasets offer. So how do we actually capture trips or mobility from these call detail records? So it kind of works like this. On the right here, I have pictured the trajectory of one user that moves around and moves between different cell tower areas. And while this user is moving around, they're active on their phones and generate these phone activities where a connection to a nearest cell tower is established. So this can be, for example, a phone call or a text message that is placed, which used to be the two predominant ways of signals that were produced, but more and more also mobile data signals kind of have increased the resolution of this data a lot. So because mobile data is exchanged often when you use apps, when you use navigation apps, but also if your phone checks for new emails in the background. And all this leads to a communication with the nearest cell tower. And these kinds of events are logged in the so-called call detail record by the MNO as part of their day-to-day operations. So you have basically a timestamp and then a cell tower designation and the device ID. And from this call detail record, you can extract the trips of individuals. So for example, we have here on the right this user that starts in cell tower area A. And then based on their activity, I see that they make a stop in cell tower area B, and then they go on to cell tower C. And so I can read this as one trip from A to B and one trip from B to C. So this is what you can extract from these call detail records. And then what usually happens is that this data is aggregated on many levels. So for one, it's aggregated spatially. So the cell towers are then mapped to the nearest, for example, administrative district on some administrative level. They're grouped temporally. So for example, you count all trips that happen within one day. And they are most often aggregated from the individual to the population. So you cannot really follow the trajectory of one single user, as I've shown here, but you count all the trips in the population that take place between region A and B. And so the result of this is a data set such as you see here on the right for Germany, which is often called an origin-destination matrix or a traffic matrix in literature, which basically tells you how many people move between regions on a given day. So for example, here we have for one date, we know the start district and the end district and the number of people that moved there. And so this captures the trips of all mobile phone users that an MNO has in a given time frame on a given administrative level. Yeah, so this gives you a very good picture of the mobility in a population. Another type of data, which is a bit more detailed, is smartphone GPS data. So this means that you measure mobility using the smartphone's built-in GPS feature, which has the advantage that you don't measure it on a cell tower level, but you measure it really the location with a high spatial accuracy. So GPS is most often accurate on a range of meters, which is a lot different than just having the cell tower or administrative level district then. How this GPS signal is collected depends a lot on which service collects the signal. Most often it works like this, that during the app usage, so if you use an app on your smartphone, a company can record this data if a software developer kit is integrated into this app. So for example, if I want to build a Google Maps application, what I can do is I can use one of these software developer kits that these companies provide. And then it's easier for me to access the GPS features of the phone using this SDK. And the company that provides the SDK can also, and then sort of as a middleman, gather the statistical data and use it for their own statistical analysis purposes. And this is what a lot of these companies do. And they also, create data sets from this data that they capture. Or there's also a different way, for example, by using the Google location history that is stored on Android phones during the uses of different apps, or just when a signal to a cell tower is established, or when some app asks for the device's location. So there are different ways in which this data is generated. And in general, the data quality also depends heavily on what is the exact source. So for example, the number of users that you have or the number of signals that they produce depends heavily on which app actually does the measurement. And also on the market share of this app, and also on the general proliferation of smartphones in an area. So this can lead to that this GPS data is not as ubiquitous as mobile phone datasets or CDR datasets that I've talked about before, because it it necessitates a good proliferation of smartphones in an area, which can often be not the case for low and middle income countries. So, but basically the mobility that you measure is quite similar to the CDR data that I've shown before, only that you have it with a much higher temporal and spatial accuracy. So anytime along a user's trajectory that such a geolocation measurement occurs, you can log this event and you know the latitude and longitude and the device ID, for example. And this makes it possible to follow the trajectories of individuals with very high precision and accuracy. So yeah, the big difference is that you have a very high temporal density, so you can really retrace individual paths. And you have a high spatial accuracy, which means that individual locations or points of interest can be distinguished. And that's basically the main one of the main differences. You don't only know in which district a person was, but also really at which street corner the person was, or whether the person was in this restaurant or in this store. And then often also these trajectories are available on the individual level, so not aggregated on population averages, which means that you can follow an individual trajectory over time and look at what locations a specific user has visited. However, with that comes more privacy issues, because if you give me such a trajectory, even if you remove all identifying features about the user, still a lot can be read from this. For example, the home location or the work location. For example, by looking at where does this person produce most data, where is the person during nighttime. And you could also read visits to sensitive locations such as doctors or schools. And so often then masking or anonymization techniques are employed, for example, by blurring out specific sensitive locations or masking the home location, or by applying a noise to the location measurement. But of course, this makes the data also a bit more coarse and kind of defeats the higher resolution of it. So just to give an example of what value this GPS data can bring, I want to show one recent study from last year on COVID-19, where they have used this GPS data to get a network of points of interest. So this is shown here on the left. The purple plane shows a network of points of interest. So these are stores, restaurants, and so on, and how people move between them. And then what they did is simulated an epidemic on this network. And if you have such a high resolution mobility network, you can even say things like, where do infections take place? And in the study, for example, they found out that most infections take place in restaurants, fitness centers, cafes, and so on. And this information is, of course, immensely helpful to policymakers when they're thinking about limiting mobility or limiting the occupancy in certain types of locations. So, okay, this is just a table. I will just go over it quickly. You can look at it also later in the slides. Just a summary of the advantages of CDR data and GPS data. So in general, GPS data is a lot more accurate, has a higher spatial and temporal resolution, and it allows, most often the users are distinguishable. However, with that come some privacy concerns, whereas CDR data is in general anonymous because you only know the number of individuals that move. And also CDR data has the great advantage that it is has a very good global availability because it's tied to the proliferation of mobile phones, which is very good in most countries. And CDR data is in general more representative of the population because you have a higher proliferation of mobile phones in the population. Whereas smartphone GPS data is worse because it is tied to a specific demographic and you have a smaller sample size in general. Then I just want to briefly mention there are also social media data sets. where the properties of it depend a lot on which service exactly the data is generated from. So usually it works like this, that a location measurement of a user is done during the usage of the service. So for example, on Twitter, if I post a tweet, I can include my location with it. Around 1% of users do that. Some unknowingly, some maybe knowingly, depending on what setting they have in their app. But that means that my location can be included in the tweet's metadata, and that can be read out by researchers. The advantage is that this is very easy to access, this type of data, and essentially free or cheap because it's public information, which is the reason why a lot of researchers, for example, have worked with Twitter data in the past. The disadvantage is, of course, that it is often of low quality, and because you have a very small sample, it can be very sparse, depending, for example, on how much a user tweets, which is not a lot for most users. So it only gives you like a statistical snapshot of mobility. And there are strong representation biases in the data because it is tied to the demographic that uses the specific service. So this was sort of now a walkthrough through the main data sets that are out there. And now I want to talk about some specific use cases for mobility data. So what can we actually do and why is it useful? And what I want to highlight is that just mobility data can be applied or is useful in a lot of different contexts. Basically, every phenomenon that is tied to the movement of humans or human mobility can in some way be enlightened through mobility data. And I just want to go briefly through a few of these areas where mobility data is used. So one of the early usages was for population mapping. And this is just an example of a general trend that you can use mobility data as another variable, as another indicator that you can collect on a national level, for example. So in this study, for example, they have shown that you can very accurately predict the population in Portugal here, for example, just based by the number of mobile phone signals that you get from each area. And that this approach is also comparable to remote sensing techniques that were used before based on geodata. And in a similar fashion, for example, you can use it to estimate socioeconomic indicators or demographic variables of a country. For example, here they showed that if you use mobility data and the mobile phone population, you can estimate socioeconomic indicators such as the global poverty index for Senegal here, where they have trained a model on mobile phone data, and it very accurately reproduces what is actually measured. And so this is one usage of mobility data, mainly as a local indicator, as a local variable that you can measure and combine with other measurements. You can also, of course, look at like really mobility, so the movements of people between locations. For example, this is done to study migration behavior or crisis displacement, so movements after natural disasters or wars or floods or hurricanes. For example, this is a recent study done in part by Unicef also, where they monitored the migration from Venezuela in the recent in 2019, based on Facebook posts and Facebook data, and which could accurately reproduce what was gained from surveys. On a more smaller scale, it can be used to look at cities and urban development, or the shape of cities in general, commuting patterns. For example, here on the right, they have used mobile phone data sets, mobile phone flows, to measure the usage pattern of roads. This can also help with city planning and traffic planning. And then, of course, there's the big field of epidemic simulations and tracking behavior during epidemics, which has always been an interesting field of research, but which has exploded in 2020 So here are just some of the headlines of studies that have come out in that time that have heavily relied on mobility data. And there are sort of two aspects of this. So one is you can use mobility data to simulate epidemic spread. And this has sort of been the classical use case. So here's one study, how it was applied recently in the context of COVID, where you basically can predict how an epidemic spreads by using mobility data, because infectious diseases only spread when people have contact with each other. And to know when people have contact with each other, you need mobility data. So here, actually, they have high resolution mobility data from Foursquare and separated it in different layers of interactions and mobility. So for example, interactions at school, interactions at the workplace or in the household. And then on the bottom, you see how such an epidemic model looks. So you have susceptible individuals that can become infected and then they can recover. And this is one ongoing field where mobility data is used heavily, because it is basically the one ingredient that you need in order to apply these epidemic models in a specific country, in a specific area. And then another topic that has also come up a lot due to COVID is to look at behavioral changes or mobility changes during epidemics, which wasn't that big of a question before, but mobility data has proven to be very helpful in this context. And here I want to show the case as a case study, the work that we've been doing at the Robert Koch Institute and the Ministry of Health, where we track mobility during the COVID-19 pandemic in Germany using this mobility data. So this project was started in February 2020, and it's hosted at the Robert Koch Institute and the German Ministry of Health and done by our group. And it basically started because we got two mobile phone CDR datasets from two MNOs in Germany. So on the right, you see one of those datasets. So we know the number of movements on a daily level between counties in Germany. And so what we wanted to look at is, well, how did the mobility change in Germany during the pandemic? What was the effect of mobility restrictions and lockdowns? How were different types of mobility affected? And so on and so on. It was like every week, every two, we had a new set of questions as the situation evolved, but we were able to answer a lot of questions with this one data set, which is also an underlying theme with mobility data, that they contain a lot of information and you can really answer a lot of questions with the same data set. So what we looked at first is, how did mobility, like in general on a national level, change in Germany? And what we found is that here on the left, you see the mobility network for February 2020, so shortly before everything began in Germany. And then in March 2020, during the first lockdown. And what you can immediately see just from looking at this is that mobility has been reduced significantly. So we had less trips overall. And specifically what we found out when we looked at it more closely is that the mobility that was reduced most was long-range mobility. So here on the left, you see these fine lines that cross the country, that connect different parts of the country with each other. And these were sort of the first to fall away. And this had some very interesting effects because it made mobility more local, which actually helped to mitigate the spread of COVID-19 because it wasn't able to spread over long distances as quickly as during normal mobility. Which was a very interesting insight for the future also. So, and this was like the immediate reaction, but what we did then is also track this throughout the course of the whole pandemic. So here on the left, so here you see the change in mobility in Germany when we compare it to 2019. So 0% means normal mobility. And what you can see on the left is that during the first lockdown, mobility fell almost immediately down to 40% below normal, and then slowly recovered. And then in the fall, actually, we had a bit higher mobility than usual, which when we looked at the maps, we found out that was actually due to vacation traffic. So a lot of people couldn't go abroad and they stayed in Germany and went, for example, to the Baltic Sea. So here you can see the Northeast is red. Everybody's at the beach and relaxing there. And then what's interesting is you can see the different phases of the pandemic and how different the reaction is in different phases. So in November, for example, we had this lockdown light at the start of November. And again, you immediately see that there's a reaction and that mobility was reduced, but it wasn't reduced as much as during the first lockdown. And this was very interesting because this is a great example of real-time insights that you can gain from monitoring mobility that is also relevant to policymakers, because then they know what is the effect of their restrictions. Are they strong enough? Should we increase them? And these are insights that you can get in near real time. So we always got the data until for yesterday, basically. So we could really monitor it in real time. And then, so we answered a lot of different questions regarding mobility. Just one example, a couple of weeks ago, we had the question whether curfews should be imposed. It was talked about, so whether there should be curfews after 10 p.m., so nobody should go out after 10 p.m. And then we looked at this hourly mobility in Germany, and we found that only a small percentage of all trips falls into that time frame. And when we looked at areas where curfews were imposed, we also found that not all of these trips fall away if you do a curfew, because a lot of them are also necessary. They are work-related. And we also observed that people kind of adapted to the curfew and then shifted their movements to earlier times, for example. So if the curfew starts at 10, I try to do my visit at 9 or something. And so this is one example of the questions that kind of popped up weekly, where we were able to quickly find answers from our mobility data set. One interesting aspect of the whole project that I want to talk about also is how to communicate these results to the relevant stakeholders, which was a big challenge for us initially, because usually we are a research lab, so we spend years researching something and then we write a paper and that gets accepted a year later or something. But here, this was a great example of ongoing research where the results are of immediate concern to stakeholders, to policymakers. And so what we did is we set up a website where we published our results on a daily basis and had some plots that we kept live, basically, which allowed a live monitoring. And then we accompanied that with public reports that we put online where we looked at specific aspects more in depth. And in parallel to that, we also had internal reports that we forwarded to the people in the Ministry of Health and the government. So on the website, just to show it again, here we still have it. You can go and have a look at it. We have this map where you can look at the mobility in Germany over time in different locations. Together with these national statistics or for the different federal states. And then we also have published several reports where we highlight different aspects of mobility and sort of these different questions that popped up over time that we were all able to answer with this one data set because it contains so much information. And finally, yes, we did get the paper. We did get a paper out in December 2020, which actually made it onto the cover of PNAS, which was very nice. So, okay, so before finishing with that, I just want to also talk more about some practical tips with mobility data. So you hopefully now say, okay, this is all great. I want to work with it. How can I do that? So the main question is where can you get mobility data? So it depends a lot on the sources, as I said, what type of data you want and where you can get it from. But in general, you should establish then a partnership with a data provider, which can be an MNO or a social media platform. And you can set up these research partnerships where you exchange data. And also if you use it for socially good causes, it's very, you can establish partnerships in that way. Or there's also the option to buy commercial data. For example, a lot of MNOs offer these CDR datasets actually as a commercial product, and you can simply buy the mobility data for a certain country. Or specifically in the context of Unicef, you can also use the resources that already exist in your organization, which would be to reach out to the Magic Box team, which already has data partnerships in place. And I've just highlighted some of the providers that I know of that their partnerships exist with, but there are many more. And I would recommend you to reach out to them and ask whether they could help you in your country or your area of interest. And also the Magic Box team has academic partnerships with researchers like me, which are always very interested in working with this data. And establishing a collaboration here can be also quite fruitful. And then I just some more practical tips on working with mobility data. So if you want to know who can work with this type of data, if you want to set up a team, for example, so the general roles that are very good for working with this type of data are data scientists or academic researchers with a quantitative background, such as me, but data analysts, statisticians, basically a wide field of people can work with this kind of data. And then something that you might have already noticed from the topics I talked about, but what I want to highlight is that mobility data, or like big data in general, really empowers agile research, because these big data sets often they contain a lot of information that is very unstructured or unspecific. So for example, the CDR dataset that we have on Germany, it contains a lot of information about mobility in Germany, but also about the demographics in Germany, about socioeconomic differences in Germany. And we found that often use cases or interesting lines of research open up when we explore the data. And it's a bit hard to tell often in advance what might be interesting questions or what you can answer with this data. So it makes sense to think a bit like data first, analysis later, because it just opens up a lot of possibilities that you might not have known before. So I would recommend to invest in big data capabilities. So invest in a team, invest in data sets, establishing partnerships, and getting these data sets, and also in some data infrastructure. So just storing these databases, storing this data. And the more you have, the more you have connections between these data sets that you can use and that synergize. And to also invest in partnerships with data provider, but also within your organization, and also with academics and external researchers, which can be very, very fruitful. Then lastly, I want to talk about the one topic that I've hinted at before, which is biases in mobility data, which is just something that is good to keep in mind or to know about when you work with this type of data. So the problem is that in many big data sets and in mobility data sets, you can have representation biases. And I just want to briefly highlight how I conceptually think about it, where that comes from. So traditionally, when you work on something, when you want to answer scientific questions, you start with a research question, then you design a survey or an experiment, you collect data, then you get your data set, and then you analyze it, and you get some results. And the problem is that in big data, this workflow is a bit different because you might start with some research questions, and you might do some data collection. For example, if you collect Twitter data from the internet, but often you just start with a data set that falls into your lab fully formed, so to say. So you cannot really control What is inside? You have little influence in the data set design. You don't really know what is the sample of users. You don't have all the information about the methodology. For example, if you have a mobile phone data set from an MNO, they might not tell you all their trade secrets with how exactly they measure trips. And you have in general less metadata in the data set. So for example, data about the individuals that are in the data set. So you can, it's not as easy to check whether that is really representative. And so this leads to that a lot of these big data sets and also mobility data sets have representation biases that can easily enter the data set and remain invisible, basically because you don't know about them, because you just have the data set as it is. And so just to show an example of why this is an issue in mobile phone mobility data sets, for example, if you use Twitter as a source for mobility, well, only 1% of the US population, for example, has a Twitter account or is represented in this data. And only 1% of tweets are geolocated. So you have from the start a very small sample size. And then, of course, you're tied to the specific demographic of this source. So a study has found, for example, that Twitter users are, they overrepresent densely populated areas, are mostly male. And also the ethnic distribution in the users is very far from the national, from the general population. And the same is true for mobile phone or smartphone data. With mobile phones, you do have a broad coverage, but still they are not representative of the population. And with smartphones, this problem is even compounded, especially if it's tied to the usage of a specific app. And this can become problematic in low and middle income countries, for example, particularly. So lastly, I want to briefly show this case study that we have done with the Office of Innovation, where we looked at representation biases in such CDR data sets. So what we did is we examined these call detail record mobility data sets for 3 different countries. Here on the right, you see one mobility network for Sierra Leone. And for these countries, the MNO sorted the users according to income into 5 different groups, into 5 quintiles. So income here was measured by how much the user spends on their phone contract. So how much they spend for text messages and calls and so on, and data, which is a bit of a coarse measurement, but which has been shown to correlate with socioeconomic status and wealth. And the question was, how are these different groups of users represented in the data set? Are they represented equally or not? So what we immediately found out is an imbalance in that high income users are overrepresented. So first we just looked at simply what fraction of trips in the data set come from which group of users. And the groups of users are of equal size. So each group contains 20% of all users. But we found that the richest 20% actually contribute 50% of all trips in the overall data set. And this can be an issue because the mobility patterns of these user groups are actually different. So here I show this mobility network again, but here are the different networks for the different income groups. And what you can see is that on the right, the wealthy users, in general, they have more trips than the poorer group, but also they are structurally different, their mobility patterns. They have more diverse connections. So they have more connections into more different regions, and they have fewer local trips. Whereas on the left, you can see the mobility network is more clustered locally, and on the right, it is more connected over long distances also. And the problem is then that in the aggregate network, because we have this imbalance that the wealthy users produce more trips, the overall network is biased towards the mobility patterns of wealthy users. And this can be an issue if you just use this data set and do research with it without accounting for this, because your results will be skewed to represent more wealthy users. So I just want to briefly show we've then worked on methods how we can debias this data set. So for example, by evening out the fraction of trips that we have from each user group, and also by filling in the mobility for areas where we don't have data for. So by estimating it from statistical models, which you can see, for example, in the top right part of Sierra Leone. And then what we did is we compared this debiased data set to the original data set by in one specific application, for example, we simulated epidemics on both data sets and looked at the differences. And what we found is that if you debias this data set, the epidemic can progress very different than if you don't. So here are shown the epidemic curves, so the number of infected over time for 3 different districts for the debiased and original data set. And you can see that the epidemic curve can arrive much sooner than you would say on the original data set. The peak can be higher or the form can be different. And so this can have severe impact and heterogeneous impact on the outcome of results. Yeah, and this can be, the impact of this bias can be very heterogeneous on a regional level. Here on the right, we showed, for example, the arrival time when the epidemic arrives in certain districts. And we found that it is especially the remote districts that are far away from the capital where the epidemic arrives earlier when you use the debiased data set instead of the original data set. So this shows that these biases might have potential impact on, for example, models that you run on this mobility data set, which is especially relevant due to COVID-19 and the heavy usage of mobility data in epidemic simulations, which are then the ground for policy that is based on them. Okay, so just to briefly wrap up, some key takeaways that I want to highlight. So I hope you've seen that mobility data can be applied in many, many different contexts. So every phenomenon that is tied to human mobility can somehow be helped with by taking mobility data into account. Mobility data also comes in many different forms and captures different types of mobility, where I've highlighted here call detail records, GPS data, and social media data. And I hope you know some of the properties of them now. And it's good to always know their limits and also their possibilities. Then I want to stress that mobility data sets contain a lot of information. So you can look at actual mobility, but also you can also use it as an indicator for socio-demographic properties of areas. And I would suggest to invest in data exploration if you're just starting out with using mobility data. Because research questions or use cases often pop up when you explore this type of data, and to invest in partnerships with data providers or academia, which pay off in the long term. And yeah, then with that, I thank you. Here are some contact information for me and some further links on our project. And yeah, thank you so much for listening.
Thank you so much, Frank. That was a very clear, methodical presentation. It was excellent to give us an overview of the various ways to get this type of data, and of course the use cases, which you gave a phenomenal array of different ways to use it. So thank you so much. I know there's been a few questions in the chat. I'm having a little trouble to look at the chat, but kindly Attila has sort of forwarded to me by email. But Frank, if you could also go through them with me. And yeah, start them from the beginning. I think it was, let's start with Jan at the beginning when you had the first slides up about the towers and the mobilities from A to B to C. So I don't know if you have that particular one up, the question, but I can read it right here. The origin destination matrix. So if the user moved from A through B to C, would this be recorded as travel between AB, BC and AC, or just AC, and what is the typical approach?
That's a good question. So this depends. So the methodology is very different from MMO to MNO. just as an example, the one that we've worked with in the COVID mobility project, their methodology is that way, that they have such a high resolution data that they can detect when you stop for longer than 15 minutes. And that's how they determine a stop. So they say, if I start in cell tower A and I start moving, I start switching towers for the first time. As soon as I stop switching cell towers for 15 minutes or more, they say, okay, the trip has ended. And then they draw a line from your start to this location. So this is one way of doing it.
Sorry, Frank, do you mind just putting up that chart that shows that?
Oh yeah, sure. Let me share my screen. Okay, here, can you see that?
Yes, thank you. Yeah,
yes.
Go ahead, sorry.
Yeah, so in this case, yeah, I haven't mentioned that, but I've indicated here the small clock with 15 minutes, like means that a user stays at this location for 15 minutes. And then you could count this as, yeah, one trip from A to B and from B to C. It's also done in different ways. So one way, for example, if your data is more coarse, if you, for example, only measure phone calls and text message activity, where you don't have as high of a coverage, you only have like 1 or 2 phone calls a day maybe, and several text messages a day. What you can do then is you draw a line from each activity to each next activity and say, okay, the person moved from here to here and from here to here and so on. But this depends a lot, yeah, on the MNO, on the type of data streams they get, the type of events they measure. But for Germany, from the 2 providers that we've worked with, it was as I described. So 15 minutes stopping is a stop.
Okay. And similar to that question, Javier asked, what does the CDR log when I don't have data service on my phone and may no call or SMS? So does it collect any data?
Well, that's a good question. So when you have the data off and you don't make phone calls and you don't, well, the thing is, if it is connected to a cell tower, I think there is always this one event stream that your phone establishes connection to a cell tower, that it looks for a network and it exchanges packages to ensure the network connection. Yeah, to get the network quality and like the bars that it shows in your phone. But I'm not 100% sure about this, and really a lot of this depends on the specifics of the MNO, and they often are also not 100% transparent with this, which is kind of what I mentioned, that a lot of the methodology of these big data, these mobile phone data sets just falls in your lab, and then you can ask, for example, how is a trip measured, and you will get an explanation. Sometimes you will even get a small PDF that tells you about it, but often it doesn't answer all your questions that you have.
Okay, so when you get sort of a data set, you're not necessarily sure if there are including the type of data that we just talked about, whether it's just you're connecting with the tower or not.
Yeah, I would. You would have to ask for that in specific cases. Yeah.
Okay. Just moving on, there's a question about, yes, I think you answered this more towards the end, but how do you gain access to the MNO data? So I think you did answer part of that at the end.
Yeah. So the data that we, for example, got for our project from the 2 different MNOs, both MNOs offer this data as a commercial product. So, for example, you can buy this data set for Germany on this resolution with this spatial resolution, this temporal resolution. You can also specify like what parameters you need there. The more fine-grained the data, like the higher the data volume, the more you have to pay in general, depending on how much processing it takes for them to compute this data set. And yeah, it's a bit hard to say what the prices of these data sets, because it is a very small market. It's very illiquid. So there you can't really unfortunately, you can't really research this and find out different prices from different MMOs. Well, you can get these, but you will have to contact them and ask for specific types of data or something. But I would recommend reaching out to MNOs in the area that you're interested in, or to seek this contact and hear about the specifications that they have.
You had also mentioned, of course, connecting with Magic Box and Unicef and some of the partnerships that they're working on. I was wondering if you have, just following up on this, any information about some of those partnerships and the costing around that, perhaps more in the countries where Unicef works?
No, unfortunately, I don't know a lot about the specifics because I myself am also an external researcher, and I work with them and I have access to some of the data sets in the project that we work on. But I don't know specifics about the partnership that they have established. But I would really recommend just reach out to them. And I'm sure that Manuel Garcia Herranz, for example, will be very happy to help you with all these questions.
Okay, thank you. So moving on to Jan's second question, and it's slide 33. So if you want to pull up that one. And his question is, how the mobility and change in mobility comparing to 2019 was measured?
That's a good question.
Just to finish up, what was the units, number of trips, and users traveling?
So what we measured, we went through a couple of iterations of how we measured this. So what we wanted to do is, if you measure the total mobility, which is the total number of trips in Germany, is always what we started with, the total number of trips in Germany. But that doesn't tell you very much. On a specific date, it might be 190 million. So what we wanted to do is compare it. We wanted to compare it to a baseline to see what would be normal. And what we did is we compared it to 2019, and we compared it always to the average number of trips on the same weekday in the same month. So for example, if I have May 2nd, 2020, and I want to know, okay, what is the usual mobility that I would expect then we looked at May 2019. We looked at, say that was a Monday. We looked at all the Mondays in May 2019. What was the average number of trips on these Mondays? And that is our normal mobility that we would expect. And that's what we compared it to. But that's not the perfect solution. There are different ways to do it. And there are some skews and things that don't work out, for example, with national holidays in either way. But that kind of was a good metric we found. Yeah.
Okay. And then we have a question from Said. He was just asking, what software did you use for analyzing the data, the mobile data? So what do you usually use? Yeah.
So my lab is very well. We're physicists and mathematicians mostly, so we do a lot of programming ourselves in Python is what we mainly use. So most of our data processing, managing of the data sets, and also our plotting is done in Python, or Jupyter notebooks, if you know about that. For the website, we actually used some JavaScript.
I don't know if it's just me, but Frank, you just went.
Oh, can you hear me?
Yes, I could hear you.
Yes, Frank, we can hear you.
Okay.
Yes.
Okay. Okay, thanks. So we use Python. This plot was actually done in Plotly, which we found was great because you can make interactive plots also that allow for some functionality. I would recommend you go to our website and check it out. We've also used Observable, which is a platform where you can do JavaScript plots. It's kind of like Jupyter notebooks for JavaScript. And we also have a report where we use that. So click around and you'll find it. And we've also tried using more business intelligence BI tools like Tableau recently, but didn't have as good experience with them. Specifically with Tableau, we had the problem that you cannot export a dashboard and put it on a website. where it is publicly available. And because everybody that wants to see this dashboard has to have a Tableau account, which was very unfortunate, which we unfortunately noticed only further down the road. And then we had to redo a lot of work. Yeah.
Thanks, Frank. It went sort of, you went frozen for a few minutes, so I was just assuming you've just finished that question.
Yeah, I think other people could hear me, so maybe it was on
Okay, sorry, maybe it was just on my side. I apologize. Okay, so just moving on. The next question I think was from Harir, and I can't remember exactly what it pertained to, but he was asking about where interactions at schools and households were also estimated through CDR or GPS. So maybe it was more, can you do that?
So let me go back to, I think that refers to this study where the smartphone GPS data was used. So this was, yeah, okay, I just said it. It was based on GPS data. So with CDR data, you in general, like the lowest level that you could have is cell tower levels. So you only know in which cell tower a user was. But you don't really get the data on this level because the MNOs don't want to disclose the locations of their cell towers because that is kind of a trade secret or very important for their infrastructure, and they want to keep that secret from their competitors, of course. And so that's why they aggregate it on administrative level. So basically, if you want anything smaller than that, then you should rely on GPS data. And here with GPS data, you can distinguish locations on a range of meters. So with that, you can actually really say if a person is walking down the street, if a person goes into a store, like which store it was specifically. And this is the only way where you can really say, okay, the person was in this restaurant or the person was in this store and this fitness studio. And this is what they did in this study, for example, for, I don't even know, I think it's Boston, Boston area. A lot of this research is done on Boston because there are good partnerships established there. And and then you can answer questions such as this. So questions that pertain to mobility of individuals in specific locations. Yeah.
Frank. Okay, so moving on, James is just asking about your opinion on the freely available Google and Facebook mobility data sets. Are they easy to access? Are they updated daily, etc.?
So I'm not sure 100% which data sets he means. I know there are these COVID mobility reports that Google and Apple publish. So maybe those. There are, so those are the ones I had a look at, which are the ones that are freely publicly available. They are a bit difficult to assess because, so with the Apple one, they distinguish between types of mobility. I think they distinguish between walking, driving with a vehicle, and so on. And you only get these very aggregate curves. So you only get these aggregate curves for a whole country. And what we found is that they're quite different from what we see from the mobile phones, which also might, so actually we've started at one time getting all these data sources and comparing them, which was very interesting. So with the Apple data, for example, what you see is that in Germany, we saw a huge increase in mobility over the fall. Which is kind of something I've shown also from our mobile phone data. We also see that the people were going on vacation in the fall, but with Apple, in the Apple data set, this is like a huge increase. So I think these data sets are really less representative even than the mobile phone data sets and very tied to the specific demographics. And also with the Google data set, for example, I think the one that they published is specifically tied to Google Maps, to the application, because they know because they distinguish mobility in parks, for example, or in grocery stores, or at home, or at working. So they do a lot of processing before they publish these data sets. And then you have the issue again that you don't really know like how they measure work locations or how they measure home locations. So you always have to take these kinds of data sets with a grain of salt.
Okay, thank you. Well understood. Moving on to Jan's, I think it's the second or third question. You wondered if you could explain more on how did you assess the overrepresentation of wealthy users. Yeah, I found your slides on those really interesting. But yeah, perhaps you can answer that specific question.
Yeah, sure. Let me just go there. So with these data sets, so usually you only get one data set for all the users that the MNO has and all the trips that they measured in these users. And what the MNO did here is, segment the users into these 5 quintiles and then give us one data set for each quintile as they are shown here. So we have 5 different data sets. And for each data set, we know we have these regions and we know the number of trips between certain regions. So, and what we did for this analysis is just to count the total number of trips that we have in each of these networks. So we count up all trips that we have in these networks. And then, we looked at their relation to each other. So if we sum them all together, they make up the full network. And what we found is then, that this network Q1 only accounts for 4% of all the trips in this full network. So again, sorry, I'm switching around now a bit, but this right network is the full network. These networks are separated into these quintiles, but if I add them up, they give the full network. And these fractions just signify how much trips do we have in these different compartment networks. And and we were very lucky to be able to do that for 3 countries. And we found that, we have kind of the same distribution in all of these countries, which is very remarkable. And which is also, by the way, by different MNOs. So it's even different data sources, so to say. We're currently finishing up the publication on that, and I hope that will be out soon.
Thank you. The next set of questions is sort of more about the characteristics of some of the data. So one question from Jay is about what are the key population characteristics available in the CDR data, and do they differ by country? And I'll just add on a couple of other things. Can this data also then be used for like gender, age, and can we do track movement of children? So I've just sort of consolidated all those types of questions together. Over to you.
Yeah. So in general, in its basic form, what you get, let me go back to the CDR data set that I've shown. It depends a lot in what form you get the data, but the basic form that you get is this here, which is just for each date, you have the number of trips between each of these compartments. So this is the basic CDR data set. So there's no metadata included. There's nothing more. I mean, there's a lot of information contained in this, but there's not a lot of metadata. And the rest, what else is possible, depends on the MNO, depends on what they are able to, what they're able to do in their processing. For example, the MNOs that we've been working with in Germany, what they also offer is to go into more detail and to include more metadata. For example, we would be able to get these mobility origin destination matrices depending for different age groups, for different genders. They would be able to distinguish tourists and residents of Germany, things like that. But this depends a lot on the MNO, and I can't really say in general how that is like globally. So globally, you should just assume that this is the base thing that they are able to do, but they might be able to include also vastly more metadata. So for example, for this other study on the representation bias, they segmented the user into wealth groups. So something like this is also possible. But I think this you have to talk about then one-to-one with the MNO. And it is helpful to have a good partnership with an MNO then, because you can quickly explore what is possible here.
Thank you, Frank. I think we have exhausted the questions so far, but we're still on for a few more minutes anyways. I had a couple of follow-up questions for you. One was, you had mentioned sort of the three main sources of data. One was, of course, CDR, then the GPS, and then the social media data sets. It's clear that the CDR data is the one that's most used, but do you have a percentage, or how many people do use that sort of that GPS data or the other types of data to do this type of analysis?
So I think also this has changed over the years a bit. So in the 2000s, you had a lot of single experiments, a lot of active measuring, where, for example, students were giving GPS trackers or smartphones with special apps. It was mostly students, because mostly academics did this type of research. And then you had more and more of the CDR data. And because, as I said, has a very good availability, and so this quickly was the dominant form of data set. Also, the MNOs started to make this really as a product, as a more of a commodity, and like had a uniform methodology with how these types of data sets are produced. So this became dominant. A lot of research is also based on Twitter data, but I think only because it is freely available. So there are a lot of studies based on Twitter data, but this is often because it's just separate research groups that can easily access this kind of data. And so for example, if you're thinking of applying it in a context where you really want to base policy on these insights, I would not recommend to use social media data, or to make sure that it has a really good quality. So there are, for example, Facebook is aggregating data in a way, or Google is also offering more of this data, where they really have built a lot on how they process this data to make it representative. But there it's really helpful to go into the specifics then. And I wanted to say something more, but I forgot what. Oh yeah, and then the most interesting development in recent years has been this smartphone GPS data that has kind of taken off more and more, because of the increased proliferation of smartphones and app usage and these data streams, but also these companies that I mentioned, like Cubic and SafeGraph, they have also been only around for the past couple of years, and they have really professionalized the way how you can extract this mobility data from smartphones. And for example, SafeGraph, what they did is they published one data set in last year, specifically to help with COVID research. And this is the data set actually that the study that I've shown was based on. So this data set was published by SafeGraph. And this kind of shows that, these kind of data sets have become more professionalized, so that they can also just publicly publish such a data set, which, I mean, you have to think about, you really have to pay attention then to privacy concerns. So you really have to be sure of your methodology with which you anonymize users, with which you mask sensitive locations and things like that. And this has really been more professionalized in the recent years and makes it easier to use this kind of data also.
Okay, I think we have a few more questions in. So one is just a comment from Jan saying that Tableau, that you can publish dashboards on Tableau Public, which is free, and embed them in your website. So thank you for that. Saeed had a question. Sorry.
I'm sorry. Thank you for that. We actually tried that, but we found that it was too slow. So we embedded it in the website and it took a few seconds to load. And then we have this map with the time slider. And when you move the time slider, then again it froze. You have a
Right.
loading thing for a couple of seconds, and then yeah. But thanks very much for the suggestion. Yeah.
Okay, maybe Jan can respond to that. And in the meantime, Saeed had a question about, can you please share the, oh yes, we will definitely share the presentation, no problem. Jan also has a question about how the start and end districts are being identified. So how do you identify those? Is it by name? Is it by code? Or in general, would the MNOs be able or willing to share the district boundaries on how they do that?
Yeah, so I mean, it depends on which country you're looking at. There are different geographical systems in different areas of the world. For example, in Germany, we have this NUTS system, NUTS, which is a really great French abbreviation that I can think of now. And so this is a hierarchy of basically it goes from country level to districts, to counties, to municipalities. And so there are different levels. And depending on which MNO you're working with and depending on how your country is structured, they will be able to provide you this data on one of these levels.
Okay.
So there's also this administrative level classification from the UN, I think, which goes from admin level 0, 1, 2, 3, and so on. But usually when you talk with an MNO, they will have they will have a specific they will have specific boundaries that they use internally, and they will be able, for example, to provide you like either to say we're using this in the system and we have this classification, or they can also give you the shape files as they're called, which are like the segmentations of the country, and then you can translate that into another system, or you can just work with that. So that is most often not the problem. So that's, yeah, it's not a big problem. It depends a bit on the MNO and the country you're looking at.
Okay. Okay. Well, that's very helpful. I didn't finish off his question there because he was just saying that in low middle income countries, we often see various data sets, admin data sets. So mapping the data might be difficult, but you're saying that the MNO does provide it at different levels. So thank you so much. We're almost out of time. I have one last question. It was such an intriguing presentation on how this data has evolved over the years, and especially when you showed in 2003 or whatever it was, 2005 to whatever, the Pope's inauguration. And in the end, you sort of said, you know, in sort of now it's all this data that's coming up using all these various sources. How do you see the future and using this type of data?
It's very interesting. That's a very good question. It's really hard to tell because the space is evolving a lot with how the technologies are used. So this is one aspect, like which technologies are used, which services are used, what are data streams that are good and representative. And the other question is also how commercially viable is this data? Because if you want to work with this data, you require some data provider that aggregates this data for you and processes this data for you. And for example, the MNOs can do it, but a lot of them, so some of them do it because they sell this data and they make a profit from this. But I also know of MNOs that have stopped processing this data because they found it was not profitable. Because it takes a lot of processing, like to go through all the events in the call detail records of a whole country, takes a lot of processing power. And then they sell it, for example, to traffic, to regional traffic agencies or something. But that is a very small market. And so I know a lot of the MNOs, for example, that have stopped processing this data. And so it's not available anymore. This is one change that I've seen, although it is hard to tell now how COVID has changed that, because COVID has shown that this type of data is useful in many contexts, and also that mobility can change a lot, and it is helpful to monitor it. So this might have been a change here. And at the same time, what I also mentioned is the rise of these GPS data providers like Cubic or SafeGraph, which seem to be thriving and seem to be doing well. So if they keep having a market as they apparently do, then that will also help with professionalizing this data. And I think the general direction is then that it will go more into the form of finished data products that are distributed by companies like Cubic or SafeGraph. So less, you go further away from raw data. So in the Wild West times, it used to be MNO just gave you pretty raw data and said, okay, do with it what you want. But now, like this Cubic or SafeGraph data is very processed and aggregated. And you can say, for example, I am interested in points of interests in the center of Berlin or something. So give me your points of interest data for Berlin. Kind of, you can imagine it like in Google Maps. When you look at a location, you see how many people are at this location on certain times of day, stuff like this. So very more processed information about mobility.
Right.
So I think that is one trend that will become more and more.
Okay, well, interesting. I know we're out of time. I just saw a message from Jan saying perhaps you could try Apache Superset. So maybe that's something you can.
We
also
actually
try that. Okay. But I want to thank you so much, Frank. This has been a really interesting and very comprehensive review that we have received. And as you can see from all the conversations, I think everyone has really enjoyed the presentation and learned a lot. So thank you so much, Frank, and thank you to all the participants for your actions and for your questions. And we look forward to seeing you next week when we have Claudia Kappa, and she'll be looking at data from children in residential care. So thank you so much. And Frank, thank you so much. It was an excellent presentation. We enjoyed it very much.
Thank you so much for having me, and feel free to reach out to me if you have any further questions on any of the topics.
Excellent, Frank. Thank you so much. Bye, everybody. Have a good day or evening.
Bye.